Catherine, JJ, Diego, and Maggie on screen, 4 people with different types of disabilities. We hear the voice of Marlene Sayo, Executive Director of the National Disability Rights Network.
For decades, the disability rights movement has really been working towards equality for everyone with a disability, and we continue this fight on a daily basis. And then the pandemic hits.
Various news clips from around the world about how the pandemic impacts people with disabilities.
The pandemic is taking its toll on people with disabilities on several fronts.
People with disabilities are experiencing increased barriers to care.
Many live in long-term care facilities, which are at greater risk for coronavirus deaths.
The number of in-home care workers has dropped due to illness or lack of personal protective equipment.
Families of students with disabilities say their kids are being left behind.
Working from home created opportunities for those living with disabilities.
Now is a good time to take stock of the lessons learned from the pandemic.
During COVID, what we found was that all of a sudden, there were solutions to ongoing problems within the disability community. And these solutions came about because now it was affecting everyone. But at the same time, COVID put the spotlight on ongoing issues within our community that were now exacerbated by the pandemic and the lack of access to accommodations and services.
Text on screen, disability during a pandemic. Then, signage from the offices of the National Disability Rights Network, Disability Law Center of Alaska, Disability Rights Florida, and the Arizona Center for Disability Law.
DRN is the National Disability Rights Network, and we are a network of protection and advocacy agencies and client assistance program agencies.
Catherine, Diego, JJ, and Maggie getting ready. Then Marlene.
We work on a daily basis to protect the rights of all people with disabilities. Before the pandemic, we saw more often than not, individuals with disabilities would request accommodations from their employer, and they would be denied these accommodations.
Diego on his laptop watching a video. Then he holds up a small sign that says, "I have a question."
And we have parents fighting for IEP meetings and fighting for services in schools.
JJ in his house with his parents. Then Catherine receiving in-home care. Then Marlene.
We experienced the inability for individuals living at home and receiving services at home to have access to regular, consistent home health care services. Prior to the pandemic, time and time again, we saw how the system was failing the disability community.
Maggie rolls out of her car from a motorized ramp. Maggie Winston, a wheelchair user with long bright green hair, purple glasses, and tattoos.
My name is Maggie, and I live in Kenai, Alaska.
Sign for Kenai, Alaska. Kenai is written in big red letters, with the city's emblem below it. Photo of Maggie at her children's graduation. Then, photo of Maggie at Pride.
I'm 38, almost 39, and I'm a mom, and I have a disability. Pretty significant one.
Maggie speaks to the camera from her living room.
Thinking about working in an office 9 to 5, 5 days a week, that is a pretty big barrier.
Maggie's PCA pushes a large metal transferring device with loops attached to a frame into view and straps Maggie into it, transferring her into her chair. Then she helps Maggie get ready.
It's very uncomfortable. My body is so sensitive to cold. There's a lot of pain. May of 2019, I was working part-time when I learned about a full-time position with nearly double the pay. I applied for it.
Maggie uses her chin control to drive her wheelchair out of her bedroom.
The position was intended to be in office. So within my first interview, I said that I would require accommodation. The position would need to be remote.
Leslie Janing, an attorney at the Disability Law Center of Alaska.
Prior to the pandemic, employers were quite rigid in how they viewed the workplace and the accommodations and reasonable requests that they would grant to employees. A reasonable accommodation is not a special privilege. It allows a person with a disability to successfully perform their work, and it's the law.
Maggie.
The whole process took almost a year, and I had given up on it several times. I finally got the job and was told that I might have been the first state employee to be hired completely for telework.
Maggie in bed and a close-up of her head-tracking webcam on top of her laptop screen as she demonstrates how to use it. Then Maggie.
I hate the word special attached to anything having to do with accommodation because no, it's not special privileges, it's not special treatment.
Maggie working from her bed.
It's just me being able to do the same job that anybody else can, but in a different way.
shots of a cactus in the front yard, then a close-up of a family photo. Diego Rico, a teenage boy wearing a blue shirt and a helmet, gets ready for school as his mom helps Diego sit at his laptop.
Diego is a 16-year-old who is a freshman in high school. He also has some disabilities.
Jennifer Schowingert, Diego's mom, a woman with short gray hair wearing a green top.
He has cerebral palsy, a severe form of epilepsy, and he has a lot of respiratory issues.
Jennifer sits Diego in a chair to watch TV and then feeds him via a feeding tube. Then, Diego's dad puts a nebulizer mask on his face as mom rubs his head.
We do a lot of multitasking here, catching up on all the late night shows. We eat at the same time, we'll do medicine. Diego has a whole respiratory regimen that he follows, but he is a kid who wants to be out there in the middle of everything.
Photos of Diego doing various activities in community, like being in the Boy Scouts and wearing Special Olympics medals.
He wants to participate and he wants to be included. And I look at it as our role to then find the ways to open those doors for him.
Cell phone video of Diego at school. Then, J.J. Rico, CEO of Arizona Center for Disability Law. He's a Hispanic man with short black hair wearing a gray polo shirt.
My name is J.J. Rico. I'm the CEO for the Arizona Center for Disability Law, a protection and advocacy agency in Arizona, and also known as Diego's dad. So an IEP is an individualized education program. An easy way to think about it is a contract between the school and the child saying these are the services we're going to provide you, hours of therapy you're entitled to, the IDEA, which is the Individuals with Disabilities Education Act. It's a federal law which spells out that a child with a disability is entitled to a free, appropriate public education. Historically, that wasn't always the case, so a law like this was needed to ensure that children with disabilities also had access to the classroom. We have seen school districts prior to COVID. We're not always following the IEP. Our number one phone call is about special education. Families are not calling us to tell us the great news that schools are doing the appropriate thing. It's usually the challenges that a school has denied something. School oftentimes says they don't have the resources to provide, let's say a one-on-one aide or a speech therapist for an hour a week.
Photo of Diego enjoying school with a friend. Then, a clip of him at school. Then, photos of Diego doing physical therapy and a young Diego at graduation.
And each parent has to advocate for their child to make sure that they have access to the classroom and all the services they need to hopefully one day graduate.
The outside of a home in Florida. Then, J.J. Holmes speaks using his iPad as an AAC device.
My name is J.J. Holmes. I'm from Longwood, Florida. I live with my mom and dad and my little sister and my 2 crazy dogs. I'm 19. I will be graduating in May.
Allison Holmes, JJ's mom, sits on the couch next to her husband. Then, JJ's mom feeds JJ a drink through a straw.
In Florida, when you have a child with disabilities and they can't live independently, there's a waiver program, which means that they can continue living at home with help instead of going into an institution.
Rachel Siegel McLaughlin, the intake director at Disability Rights Florida, speaks. She is a Caucasian woman with shoulder-length brown hair and thin-rimmed pink glasses. She's sitting in front of a large number of books on shelves.
It's important for people to be able to live in the community instead of an institution because institutions are very segregating. The U.S. Supreme Court's Olmstead decision in 1999 found that states were now required to provide services to individuals with disabilities in home or home-like settings, which would mean that they were no longer forced to be in institutions. Home and community-based waivers are managed by the states, and the states determine the amount of funding that's allotted to those programs. If there's not enough funding for a waiver, then there is going to be a wait list.
Close up from the inside of a car of an accessible parking permit, dangling from the rearview mirror as Allison picks JJ up from school.
We got on the wait list in 2007 and have been for 16 years.
JJ asks his mom a question using his nose to type on his iPad.
Mom, when do you think I'll get off the wait list?
No idea.
Rachel's voice in the background as she reads graphics on screen.
In Florida, that wait list is over 22,000 people, and it grows every year. Individuals who are placed on the wait list have been found to be eligible for the waiver programs, but they're not able to be enrolled because there's no funding available to serve them. But even when you have services approved through the waiver, it's very hard to find home care workers to provide those services.
Annette Diaz. She is a white Hispanic woman with shoulder-length blonde hair.
My name is Annette Diaz. I live in Pembroke Pines, Florida, with my daughter, Catherine.
Catherine, a young woman with disabilities, is transferred to her wheelchair by a PCA who then puts on her leg braces. Annette.
Catherine got on the waiver in 1999. She has 24-hour care thanks to this program through Medicaid waiver. I have to be able to trust the person that comes into the home because Catherine can't communicate anything to me.
Catherine doing PT with an in-home therapist.
I have to be able to know that once I walk out that door, that she's being taken care of the way she's supposed to be.
Rachel. Then, Catherine doing more PT.
These are individuals who are coming to your home to provide very personal care to you or your family member.
Annette.
You have to find people that are willing to take a salary cut to do the home health part, because when they come in to work through an agency, they don't get benefits. They're independent contractors. Pay rate has been the same for many years, so it's just impossible to find personnel.
Marlene.
For years and years, the disability community has been a second thought from a policy perspective, from a healthcare services perspective. And then the pandemic hit.
Various news clips from around the world about the pandemic.
The World Health Organization today declared the coronavirus a global pandemic, citing the alarming levels of spread.
We expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher.
Diego looking out of a window. He is sitting on a small chest of drawers. Jennifer.
COVID happens and everything's shut down. All of the kids were online, the teachers were online.
Photos and cell phone video of Diego during the pandemic. Then Jennifer.
Which was kind of nice because everybody was doing the same thing. So we were in the same boat as everybody else. Right, Diego? Do you remember? We got on your classes on Google Classroom and we logged in, and Diego even had choir. But it did start to get a little bit trickier because, especially with the therapies, it's difficult to have the same effect when you're trying to do that remotely.
Diego's sitting at his school laptop holding his mom's hand. Then JJ Rico, then Diego at PT.
There was a period where he got 0, I think, physical therapy. We decided we'll just do something outside of the school, but some families don't have that option, so students lost out on those services.
Photo of Diego feeding himself with a large adaptive spoon. Then, Diego feeding himself with a typical spoon as a therapist holds the bowl of food under him. JJ Rico.
The schools where they're getting the therapies and they're getting the support, and the schools are closed or the schools are risky environments, they have been closed off from access to that.
News headline from The Guardian. It's only going to get worse. Mask war in Arizona schools ramps up as COVID cases soar.
When schools reopened in Arizona, there was a movement of some schools not requiring masks whatsoever, which obviously exposed kids who might be medically fragile.
Bar chart showing the fatality rate for people under 17 without and with intellectual or developmental disabilities. The numbers are 0.01% and 1.6%, respectively.
Statistics have shown people with disabilities are more susceptible and also experienced higher infection, death rates, etc. So parents are making that decision, exposure versus access to education.
Trees over a body of water. We return to Florida. Then, Rachel from Disability Rights Florida.
Even before COVID, it was very difficult to find in-home providers. With the pandemic, we faced record shortages of nursing workers and home care providers. According to a study by Anchor Foundation, United Cerebral Palsy, as of fall 2021, 77% of providers were turning away new referrals, and 84% were delaying the launch of new programs and services due to lack of staffing.
Marlene.
It's very important to ensure that we're building a workforce that's welcoming for those that choose home health care as their career. Right? And so you want them to have a living wage. You want them to have access to benefits. And you want them to be able to have a structure in place that protects them and provides them with the protections that they needed, especially during COVID.
Photo of Catherine smiling with a PCA. Then Annette taking care of Catherine.
Once the pandemic hit, we lost one of our nurses, Marie. She had been with us 19 years. I haven't been able to find a nurse to fill in her time slot.
Rachel. Then, Annette preparing food for Catherine.
A lot of families struggle with an immediate need to find care for family members who've been getting home care from agencies prior to the pandemic who might no longer be able to access that service. Annette struggles. When she lost one of her nursing providers to COVID, she was expected to pick up the slack for those services that weren't there.
Annette.
I work 4 nights a week, 4 16-hour shifts. Then I have the personal care assistant in the daytime.
Catherine with a PCA. Annette is in the foreground facing them.
She's here only 8 hours, but she can't do everything for her either. So it's not even that I can hand her off and leave her with her. I have to do certain things like feed her.
Annette feeds Catherine via a feeding tube.
Trying to sleep that's something that I don't remember the last time I did well.
Annette strokes Catherine's hair while feeding her.
Catherine needs somebody 24/7. I couldn't imagine her being in a facility where she didn't have somebody one-on-one for her.
Rachel, then JJ coming down a wheelchair ramp from a car with his dad.
We need to make sure that the states are fully funding our home and community-based waiver programs. A large number of our caregivers are aging and will no longer be able to provide care to their family members. And if those individuals can't access our HCBS waiver because of a lack of funding, then they will be placed in institutional care.
JJ in his bedroom with his dad, as his dad lifts JJ from his wheelchair across the room to his bed. Then, Joseph, a man with dark hair and a gray mustache, speaks as he sits next to his wife on the couch. She has a small dog in her lap. Then, Joseph helping JJ into bed.
I'm almost 70, and I just can't imagine how many 70-year-olds are out there that's got to do the things that I do. We both have back issues, carpal tunnel. I was supposed to be getting a surgery on it, and I have to keep putting it off because the downtime is a minimum of a month. And who's going to care for my son in that month where I can't lift him?
Rachel.
Individuals with disabilities experience abuse and neglect in institutions.
News headline from the Tampa Bay Times. COVID is leaking into Florida nursing homes and cases soar. Then, Florida leads nation in nursing home resident and staff COVID-19 deaths.
Additionally, during the COVID-19 pandemic, we saw that the COVID virus spread very rapidly once an institution had an outbreak. And those patients who were living in those facilities were isolated from their families and friends.
Allison feeding JJ a sandwich. Then, Allison on the couch.
Most parents think about, well, if I died, I'll do this for my kids or that for my kids. We can't even think about it because what would happen is just so awful to think about.
Maggie's PCA puts makeup on Maggie's face, then Maggie in her living room.
So I finally started working completely from home February 24th of 2020.
Maggie working on her laptop from home.
I'm starting to get in the groove of things. And then COVID hits and the world completely shut down. And suddenly no one could go to the office and everyone was teleworking in one day.
Leslie reads graphs and text on screen. Then Leslie.
During the COVID pandemic, 35% of employees without disabilities and 25% of employees with disabilities were able to work from home. It's ironic that people with disabilities have been asking for telework and flexible accommodations for a very long time. Suddenly the pandemic hits and now we're able to do so.
Maggie.
It's total the amount of steps that I had to go through when they came up with a fix that worked for everybody right away in one day.
Marlene.
You know, as I think back on all of the difficulties that we've seen on a regular basis throughout our community, and then all of a sudden, a lot of these difficulties we were able to manage at the drop of a hat as soon as everything closed. Only highlighted for me what I've always believed to be true is the political will has always been missing when it comes to ensuring equal access to services and accommodations for people with disabilities.
News clip from CNN about the impact of the pandemic.
More than 3 years after the global pandemic that claimed nearly 7 million lives around the world. The U.S. will no longer provide many Americans with free COVID tests, treatments, vaccines at no cost.
The emergency part of this pandemic is coming to an end. For some people, this is going to seem very arbitrary and accelerated. There are people who are still vulnerable.
Jennifer drives Diego to school. Then, Diego walks with a school staff member inside. Jennifer.
This year, Diego started high school, and we wanted to try to spend more time, right, Diego? He started to return for a few hours, 2 to 3 hours at a time, about a half a day. And we still work in time for him to come home and rest after school.
JJ Rico helping Diego into the car.
We expect that going forward for the foreseeable future that he will still be on sort of a limited schedule and not be going full time.
Diego at home on his school laptop.
And so we've tried to work with schools so that he can spend some time online. Did you learn a lot today?
Yes.
Maggie's PCA feeds Maggie a drink through a straw. Then Maggie working from bed. Leslie.
By opening accommodations and telework and more of a flexible schedule for everyone, you're able to include a lot of people that might have been traditionally left out of the workforce, bring them to the table, let them have a voice and a perspective.
Maggie in her living room.
If you want someone like me to be able to work for you, then you have to accommodate them.
Maggie working from bed. Then Maggie rolls out of her car down a ramp and into her office.
In my job now, I'm able to work from home for 3 to 4 hours in the morning and then be able to go into my office for a few hours later in the afternoon.
Maggie at her desk at work. Leslie.
The reasonable accommodations that are offered to people with disabilities allow them to expand their career and have upward mobility and more opportunities.
Photos of Maggie on vacation with her family and spending time with her friends.
I was able to go on vacation, buy myself new furniture, and do other things I'd never been able to do before.
Diego at his laptop. Jennifer sitting next to him. JJ Rico.
Pre-COVID, we thought certain things weren't possible, but we were forced to do it. We've shown it can be done. So I do not think they can now sit here and deny that we can't provide learning in a remote way or in a hybrid way.
Marlene.
What we do see, even now, years later, is that some of these difficulties continue.
Catherine doing PT at home. Then Marlene.
We know now for a fact that we do not have enough home health care workers available. And so we need to invest in that. We need to build out this career path for individuals. We need to reduce the waiver wait list.
JJ's dad secures his wheelchair in the car. Then JJ in the car smiling.
It's imperative for individuals to be able to live at home and receive the services that Olmsted says that they are entitled to receive at home and not at a facility.
JJ types on his iPad with his nose.
The thought of maybe having to live in a state-run institution keeps me up at night. It's becoming more likely because I don't know when I'll get off the wait list. I have very big ambitions.
JJ rolling into a government building. Then JJ and Allison on a local TV station, speaking in front of a legislative delegation.
I want to become an advocate that fights for marginalized communities and maybe even run for office one day.
Catherine out in community. Then Rachel.
Individuals with disabilities have the right to live a full life in the community. The pandemic showed us that this is not a crisis that we can ignore any further.
Maggie leaving her office. Then Diego Rico holds his mom's hand as he wears a nebulizer mask. Marlene.
The pandemic was a horrible thing for our community and we lost a lot of loved ones. But at the same time, it really tore open the fact that we can do this and we do have the right to have access to everything equally. We should never be a second thought.
Text on screen. Learn more at covidimpacts.us. Featuring Marlene Sayo, Maggie Winston, Leslie Janing, Jonathan Diego Rico, Jennifer Showingert, JJ Rico, JJ Joseph Holmes, Allison Holmes, Rachel Siegel McLaughlin, Annette Diaz, Catherine Bott, Joseph Holmes. Protection and Advocacy Team, Disability Law Center of Alaska, Jenna Amber, Karen Tessandore, Arizona Center for Disability Law, Natalie Luna Rose, Disability Rights Florida, Keith Casebon, Robin Coker. Produced and directed by Jordan Melagrana. Cinematographer, Jordan Melagrana. Edited by Hannah Seaman. Florida Story Producer, Krista Hillstrom. Alaska Story Assistants, Courtney Cole, Doris Torres. Production Coordinator, Annalisa Mickelson. Assistant Editor, Kayla Fisher. Music, Artlist.io. Audio Description, Kyle Kakchadurian. ASL Interpretation, Esther Fass, Elizabeth Vega. Special thanks, Grace Holmes, Thomas Pillais, PT, DPT, Haiti Otano, Perline Pennyfeather, Karen Barman, Sarah Templeton. A production of Block by Block Creative. in partnership with Disability Law Center of Alaska, Arizona Center for Disability Law, Disability Rights Florida, and the National Disability Rights Network. 2 rows of 5 total logos: Disability Rights Florida, Disability Law Center of Alaska, Arizona Center for Disability Law, Block by Block Creative, and National Disability Rights Network.